So the federal government sends to every state actually a sum of money and says, instead of you do this, this, and this, they say, Arizona, you every 5 years assess the needs of the women and the children in your state. You, Arizona, decide what your priorities are and where you want to focus programs and then funding. And so what we do every 5 years is we actually try to get all sorts of folks to help us with input. We need to know what the people of Arizona think are the issues, the problems, the concerns for the women and the children in the state. We've had several what we're calling listening sessions. And what we're doing is going to different communities and saying, would you tell us what you think are the needs? And the reason we call them listening sessions is because in the spring, we will go around the state in a few different areas and do a nice presentation and talk about all the data that we have, and then ask people to help us to develop priorities. We want to listen first. We know the data we know. Maybe there's things that people in the community say, nobody ever talks about that. But we don't want to go into your meeting and say, well, here's infant mortality, here's prematurity. And somebody might be thinking, well, what I was going to talk about maybe is not so serious compared to that. So we don't want to color that. We want to just go in and listen with a clean slate of what people think are the priority needs. On our webpage now, we have a link to a survey that anyone in Arizona can take and give us feedback on what they think are the issues affecting women and children. We need the people who don't, this is not their world every day, maternal and child health, but yet their mothers, their grandmothers, their aunts, their uncles, they're people that affect and live with the women and children. We want to hear from them how they see that we should drive this boat the next 5 years. Send it to your grandma. Send it to the church women group. Send it to people who are not the typical partners that we have, because we really, really want to know what the real people of Arizona think and how they see everyday life for women and children. It's your voice. Except for voting, lots of times we don't have that much voice on how programs are run, how priorities are set. This is an opportunity for every person in Arizona.